Hi friends, today let's talk about, are heart stents a temporary fix or a permanent solution? I am Dr. Toishi Sharma, Interventional Cardiologist, and let's break this down today. Once you get a heart stent, are you fixed for life? Or is it just a temporary solution? The answer is not as simple as you think. First, let's understand what a stent does and what a stent does not do. A stent is a small metal mesh tube that is placed inside your artery. This is placed during a procedure called percutaneous coronary intervention. Now, the stent opens up the blockage and restores the flow to the muscle of your heart. Now, the question is it permanent? So, the stent itself is permanent. Once we place the stent inside your blood vessel, it stays there forever. And in fact, in newer generation stents called drug-eluting stents, they produce a medicine that prevents the restenosis of the stent. And in fact, over time, your body grows a layer inside of the stent that makes the stent a part of your own blood vessel. If a stent is permanent, then why do people still have problems after a stent? That's because a stent fixes one blockage, not the entire disease process. Coronary artery disease is a diffuse, ongoing process that can affect multiple segments of the blood vessels that supply blood to your heart, called coronary blood vessels. If someone has had a stent to fix a blockage, they could still develop a new blockage in another blood vessel, or the stent itself can develop a blockage over time in 10 to 20% of the cases. And thirdly, acute blood clots can form inside the stent itself, which can result in a heart attack. So friends, a stent is a permanent device, but a partial solution because it treats emergency or critical narrowing. But the long-term effects depends on you. So now let's understand what can you do to ensure that the outcome from your stent is truly long-lasting. Number 1, take your medications. When you get a stent placed, the body treats it as a foreign object and it tries to clot it. Therefore, if you get a stent, you have to take a minimum of 3 medications like aspirin, Plavix, and a statin medication to keep the stent open at least for 6 months to 1 year. You have to take at least aspirin and statin lifelong. Otherwise, the stent can clot or it can develop blockages inside. Number 2, you have to change your dietary habits. Taking low sodium food, low fatty food regularly with high amount of green vegetables and fresh fruits and fresh vegetables is very important. Number 3, exercising regularly is very important. It improves your circulation. It reduces the inflammation as well. And number 4, you have to treat the conditions that increase the risk of developing a blockage inside the stent. The number 1 is high cholesterol. If you have a stent, then your cholesterol, the bad cholesterol LDL, should always be less than 70. And according to newer guidelines, it should be actually less than 55. If you have diabetes, you should try for it to be very well controlled, close to a hemoglobin A1C of 6.5 to 7, because uncontrolled diabetes mellitus is associated with developing a blockage inside of the stent as well as new blockages. And thirdly, if you have had a stent, your blood pressure should always remain less than 130 by 80. The upper number should be less than 130 and the lower number should be less than 80. As you can imagine, if you have high blood pressure, any blockage can shear off or tear off and cause an acute rupture causing a heart attack. And over long term, this constant endothelial damage can result in developing blockages both inside the stent as well as new blockages. So friends, taking your medications, eating better, exercising regularly, and controlling your cholesterol, diabetes, and high blood pressure should be your topmost priority. If you do all of those things, then the chances are that you will never need a stent again, and this stent can be good for a lifetime for you. And you may not even develop new blockages if all these risk factors are well controlled. So friends, I hope that we were able to shed some light on what a stent does and what it does not do, and what are the main factors, patient-related factors, that contribute towards the development of blockages in patients who've had stents. If you have any other cardiology-related questions for me, please comment in the comment box and I'll be happy to share insights on the topic. Thank you.